Get this, 90 million Americans suffer from snoring. That's according to the National Sleep Foundation. Our Brittany Moore explains how a new treatment offered in Manhattan is making a big difference.
Debbie Bashand from Clyde had a big problem. She snored loudly.
They talk about tornadoes resembling a freight train, and this is true, and that's probably what I sounded like.
So Debbie found Dr. Daniel Winter at the Center for Dental Sleep Medicine in Manhattan.
We all need to have a normal night's rest with certain cycles through sleep, and if those cycles are interrupted, i.e. by snoring, they can interrupt the quality of our sleep.
Dr. Winter says custom-made oral appliances or mouthpieces have been used for years to help quiet snoring, but now they have a new, less invasive way to help solve the problem.
The night laze, which is the use of an erbium laser to treat snoring. What's unique about this laser is it uses smooth wave rapid pulse laser energy that actually thermally warms the tissue. By toning up that tissue back there and firming it up a little bit, get a little bit more lift, it decreases that vibration and decreases that snoring sound.
The night laze can also treat sleep apnea if the problem is with the soft tissue at the back of the throat. But making sure you have the right diagnosis is key.
We'll treat the snoring, but if the patient has other key indicators that they may have other sleep disordered breathing, I may refer back out to a physician.
Debbie has now had a couple of treatments done with the night laze, and it has made all the difference for her.
It's helped immensely. I probably still snore a little, but I had a big problem.
Since the night laze is a newer treatment option in the United States, most insurance does not cover this procedure. Dr. Winter says the standard cost is $1,500 for 4 sessions. Brittany Moore, KSNT News.